We're so glad to have you here. We're grateful, as Steve said, to all of you for coming and for all of the work that you do. I'm going to reflect in just a moment on the impact of all of that work. But first, I want to join Steve in congratulating you and thanking you for being here this week to think together and learn together about what works best to end homelessness for people, about how to address those endless challenges and roadblocks in the work that seem to get thrown in front of you all the time, and about how to find and seize the opportunities that you're presented with to move forward. We're, I think, in a little bit of a crazy moment right now. The country and indeed the world seem to be in turmoil. And I think a lot of that, my own view is a lot of it is driven by so many people's frustration and fear at increasing levels of inequity that we experience, of economic inequality, of racial inequality and discrimination. People everywhere just really want safety and opportunity for themselves and for their families. They want solid ground beneath them. And they want a playing field that is fair and that they understand. These are things we all want so that we can have a chance to better ourselves and our families. And so many people here in the US and elsewhere, rightly or wrongly, don't see that solid ground, that fair playing field, or that better future for themselves. Instead, they feel like the trajectory for them and for their children is moving to less stability and less opportunity and less safety. And that is sad, and it's negative, and it drives fear and strife, and we see that playing out in all different ways here in the US and in the world when we tune into the news every day. But we are not helpless in the face of that. This is something that you in this room can and do something about every single day in your work. We push back against those fears and against that instability and inequality. But we have to do a lot more. We have to do it more. This is shaping up to be a moment of change for all of us. Things are changing. And a theme of decision and a time of decision and potential to move in one way or the other is before us, to make choices about our future. That's the meaning of being in a time of change. The most literal thing that is happening in our world, I think, and it certainly pops up because of what happens to be going on in Philadelphia this week, is that the Obama administration, after 8 years of pushing hard to end homelessness and providing a tremendous amount of leadership and resources, is winding down. We have with us here at the conference many of the absolutely exceptional people who over the last 8 years have worked with fierce determination at USICH and HUD and HHS and VA and many other federal agencies to reduce and end homelessness. And I want to thank you, those of you who have done that, for your extraordinary work and dedication. And although Congress has been a difficult place in the last couple of years, the progress that's been made on homelessness absolutely could not have happened without Congress and a few determined members from both sides of the aisle and their extraordinary staffs. And we also owe them a tremendous debt of gratitude. And there also, lest we forget, change will be happening coming up now. And of course, elections also change things at the state level and the local level. So when there's a change and we have choices to make, it's good to reflect on where we stand and how we got here in order to figure out what we should be trying to do next. So what have you, providers, public officials, elected officials, consumers, everyone that's here, what have you accomplished since Obama was inaugurated in 2009 in the past 8 years? Well, between 2009 and 2015, based on our most recent data, what you've accomplished is you've reduced homelessness by 10%. You've reduced homelessness among individuals by 9%. You've reduced family homelessness by 13%. You've reduced chronic homelessness by 22%. You've reduced unsheltered homelessness by 24%. And you've reduced veteran homelessness by 35%. And if you want to know about youth homelessness, I can't tell you because we don't have the baseline to assess whether or not we've made progress on that in terms of the numbers, but we do know that the tremendous work has been going on in the field on youth homelessness and is growing. During this same period, it's also worth noting, the population went up 5%, vacancy rates in rental housing went down 25%, average rents went up, and at the same time, median household incomes went down. So more people, lower incomes but higher rents, all things being equal, the number of people who are homeless in the country should have gone up in the past 8 years. But it didn't. It went down. Why did it go down? Because of what you all did, because of what you've done over the past 8 years. You worked smarter, you improved your outcomes, and doing that led to more resources. You are responsible for the better lives of a lot of people over the past 8 years. You turned the ship on a significant social problem. All of the work you did is not created equal, though. So what were some of the key things, if we're looking to the future, what were some of the key things that mattered in making those reductions happen? First, the tremendous effort to end veteran homelessness. There was and is immense public and political will to help veterans, no question about that. Congress and the administration did a massive ramp up to end veteran homelessness, and they put a lot of money behind ending veteran homelessness. New interventions were added to the toolbox, in particular rapid rehousing through SSVF and prevention. At the local level, the coordination between VAs and continuums was unprecedented, cross-silo coordination, not easy, maybe not all the way there, but unprecedented. Tremendous organizing efforts were undertaken, including the White House Mayor's Challenge and the wonderful work of Community Solutions and others. The resultant reductions in veteran homelessness are really driving the overall reductions in homelessness. The message here is that with adequate resources applied to the right tools in the toolbox, some improved local coordination, a housing-first approach, and a sense of urgency, you can end homelessness. It can be done. That was the first thing. You know, I just have to say, we had a discussion yesterday with some of the leaders from various different cities in the Research Council. We were talking about unsheltered homelessness and whether we needed more shelter. And it was just pointed out that really the work on veterans and the big reductions there did not happen by increasing the shelter or slowing things down. They happened because we had rapid rehousing and we could speed things up and get the flow through moving. We had the tools and the resources to make it happen. So it struck me that's the learning from that. The second thing is the work to end chronic homelessness continued, increasingly with the promise of Medicaid to help fund on the services side. So that mainstream system link, again, that's very important. We made progress, but we did run into some roadblocks on chronic homelessness, especially toward the end. We did not get the money from Congress to go all the way to scale and solve the problem, even though we know what the solution is, so that's on them. On us is the fact that a huge percentage of the people living in permanent supportive housing were not chronically homeless when they entered it and likely did not need permanent supportive housing to end their homelessness. For example, of the 320,000 units of permanent supportive housing that the federal government funds, over 1/3 are occupied by families, and there just is not evidence that that many families require permanent supportive housing. So we do need more money, but we also need to do a much better job of targeting the resources that we have, and I know we're on the way to that. Another important development was the emergence of rapid rehousing through SSVF for veterans and also through the Continuum. That's a local innovation that rose from the ground up and went national, of course, through the HPRP, the Homeless Prevention Rapid Rehousing Program, at the beginning of the administration. Rapid rehousing is not a perfect intervention. It's not right for everyone, and there's still a lot we don't know about it. But what we do know is that it's more effective than shelter or transitional housing, or at least as effective at lower cost. By extensively using rapid rehousing, you have not only driven down the number of homeless veterans, but homelessness overall. By taking the difficult and painful steps to reallocate resources within the continuum to rapid rehousing, a job that is not yet done, you have driven down family and individual homelessness. So rapid rehousing has been an important new housing tool, one that arose from innovation at the local level. It creates flow through the system. Again, that's a key factor, not letting people get stuck in shelter. It creates flow through the system, making more shelter beds available for people in crisis, and it has been an important step forward in our effectiveness. And finally, a key step has been the shift from a program-by-program approach to a systems approach so that we are improving our effectiveness in targeting. Again, very painful, I know. And again, not yet complete. But you're doing the hard work and the better targeting, and that has resulted in ensuring that higher need people get the more intensive interventions, lower need people get the less intensive and expensive interventions, and this lets us help a lot more people and ends homelessness faster. So political will, successfully linking with the mainstream resources, building your skill, new tools and innovation and targeting have made the difference in where we were and where we are now. In summary, what you've done in the past 8 years with the help of a supportive administration through tremendous hard and sometimes painful work and against the trends pushing in the opposite direction is to reduce homelessness. Not as much as we all may have wanted, not everywhere, not solving every problem, but still, come on. I mean, homelessness is down 10% despite everything pushing against you. So that's a lot of people. Again, you deserve it more. So I think we have a solid base to stand on and from which to move forward. We have a good case to make. And that takes us to the next question, which is what's next? We have an election coming up, and a new administration and Congress will be arriving in 6 months. Many of you will have new elected leadership at home in your states and in your cities and your towns. We've been on a path for 8 years. It's my observation that new leaders often want to forge a new path. We need to think about how to get ending homelessness on the agenda of the new administration and Congress, and you need to think about how to do that at home. We need to think about what we've done and how a new path can take off from what we've done to make progress in the future. And that requires us to be frank about some of the things that we still need to work on, our shortfalls as well as our successes. Because while we've done a lot, we have still only reduced homelessness by 10%, which is not as much as we want to. And there's a lot that remains still to be done. We have an inefficient children and family system that we're struggling to reform, and that's poorly integrated with mainstream programs that link families to employment and services. Far too little is done to help stabilize children and families in housing so that they don't become homeless. We have a very poor system also for homeless women and men on their own, homeless individuals. That's the majority of people who are homeless individuals on their own. Our system for them is weak. And a third of people who are homeless have no shelter at all. Encampments are emerging. Those latter two in particular, really not acceptable. That a third of people who are homeless don't have any shelter at all. Not good. Homeless individuals are also very poorly linked to mainstream workforce and employment programs, and that is the major way they're going to be able to exit homelessness, by having an income or stay out of homelessness. And while we've made progress on chronic and veteran homelessness, we need more resources in some areas, and we need to use our resources better in others. And we've only begun to understand and ramp up on homeless youth. And major issues remain unaddressed, including the role of HHS in ending homelessness among minor youth on the youth side. So there's a lot that we still have to do. We need to make an argument to a new administration about why to prioritize homelessness and what they can accomplish, what they can own in terms of this issue. We need to show a new path, and we need to find areas of opportunity and use them to push forward on the issue overall. It's a lot about the framing and how we explain it. So here's what the National Alliance to End Homelessness plans to propose to the incoming administration. Homelessness is a type of housing crisis that's experienced by poor people. The homelessness system is a crisis response system. It responds to crises that are caused by deep poverty, by racism, and by inequality. It responds to lack of opportunity, violence, and prejudice. And it responds to a profoundly inadequate public system of care and an inadequate supply of housing that fails to support vulnerable people. However, while the homeless system's goal is to successfully address crises, end crises, not just address them, the help it gives has much more significant impact than that often on the people that it serves. It is crisis help, but because people are resourceful and poverty is fluid, it is often enough not just to end their crises, but to set people on the path to well-being. And also, of course, often we can provide people, especially people chronically homeless, people with disabilities and more serious problems with permanent housing that can do much more. It often doesn't take much help for people to get back on their feet and thrive, but it takes the right kind of help. But make no mistake, people's homelessness must be ended before they can get on with all the other things that we as a nation value and hope for them. It's really difficult for them to achieve those things while they're homeless. The good news is that we know how to end homelessness. We can end homelessness. You've proven these things. And it's right that the United States should end homelessness. I'm not applauding for myself, let me just mention that. I'm just applauding the idea that we should end homelessness. Accordingly, we propose the following goals to be achieved by the end of the new administration. First, that no child will be homeless. We must ensure that children have the stability they need, that their families are supported, and that we break any cycle of multi-generational homelessness. This means that if children and their families lose their housing, they will very quickly be returned to housing, and that we will do a much better job of preventing them from becoming homeless. Second, every woman and man who becomes homeless has a decent and supportive but short-term accommodation where they can stay on their way back to housing and connection to services to help them in the community. No one will be unsheltered or unhelped. Third, we will have finished the job of ending veteran and chronic homelessness. We know what to do to end veteran and chronic homelessness, so this is a matter of achieving scale. We'll go all the way and finish those jobs. And finally, we will have what we need in terms of data and evidence on interventions as well as resources and capacity to have ended homelessness among youth and young adults. In this way, we will achieve the goal of ending homelessness by the end of the next administration. Now, I note that we have earlier target dates on some of these, and we will not abandon those more ambitious dates. But if we fail to make those targets, we fall back on the commitments to achieve this by the end of the next administration. So I want to speak for just a moment about the first goal, that no child shall be homeless, will be homeless. Why is this a moment to focus on this goal? Because there is need and because there is opportunity. There are about 65,000 households with about 125,000 children in them who are literally homeless at a point in time. These are families living in cars and campgrounds and shelters and in homeless facilities. We know that that is not the whole story on the numbers. We have other data also. Schools are critical players in identifying and aiding homeless and at-risk children. And according to the Department of Education, in the course of a year, around 1.4 million school children were homeless. Only a minority of them, 19%, were literally homeless, that is, unsheltered or in homeless facilities. 81% were doubled up in hotels and motels. And of course, this does not include very young children who are not yet in the school system, or children who have left school, or that have not disclosed that they are homeless. So this gives us an idea of the scope and also the number of children whose families have severe housing problems every year. I think we must not underestimate the impact that the homeless crisis system can have on the well-being of children and families. Absent a significant increase in affordable housing, and I'm going to come back to that because I actually have some hope that we will have an increase in affordable housing. But absent that, it is likely that housing problems of poor households are going to worsen seriously in the near future. If housing affordability problems worsen, there will be more housing instability. If there is more housing instability, more and more families are going to become homeless. If families are increasingly unstable and increasingly lose their housing, we, on the homelessness side, need to increasingly be the system that quickly bounces them back, not captures them and keeps them, but bounces them back. And if they lose their housing again next year, and many of them may, we should bounce them back again into housing. And again, because even though housing instability is bad, homelessness is worse, and families cannot solve their problems while they're homeless, and their resources continue to be depleted. And if we don't move people through our family crisis system, we're going to have more families on the street because we just are not going to be able to build enough capacity to keep them. Is that just putting families on a housing roller coaster? I don't think it is, because getting housed does eventually lead to increased employment, increased income, increased stability, increased well-being, even among households that it looks like it's impossible that they're going to be able to stay housed when we see them. Because we often see them when they're at their nadir. You know, they're at the bottom. They've expended all their resources trying to get back into housing. So it's sometimes hard for us to feel optimistic about it. But it seems that many of them do get back on their feet. So child and family homelessness is a big problem, but we know what we need to do. We have built a system to end family homelessness, and it has made progress, as I noted before, but it's not good enough, and we need to invest in making it better. We need to speed up the process of getting families back into housing and supported in the community. This means we're going to need more housing resources, and we're going to need new housing tools. But it also means that we must not needlessly prolong homelessness or delay families' return to housing, to support networks, to employment, and to school. In the increasingly brief time that families are homeless, we need to ensure that there is enough crisis accommodation for them and that it is adequate to meet the needs of children, and resourced to focus on exits and connections to employment and services. So while they're in shelter, we need the shelter to be better and also to be more focused on the children. Also, you know, there are a lot of infants who are homeless, and some of them are unsheltered. It seems to me that maybe we should set a faster goal. Sorry, that no infant is unsheltered. I mean, what do you think? I don't think there are that many infants that are unsheltered. Couldn't we just decide that we're not going to let infants live in cars and in tents, and we're going to find a place for them to go today? Just a thought. Where was I? We must make more progress on coordination with mainstream systems of care that can support children, health, education, and employment. Mainstream programs can do a lot more to help. They could, for example, like the VA does, screen for homelessness and housing instability for anybody who enters their programs and have protocols to respond when they find that families have unstable housing or are homeless, instead of passing over that. Mainstream systems, not just the homeless system, can include reductions in homelessness in their performance indicators. How come we're the only ones that have to put reducing homelessness in our performance indicators? These are the systems that are supposed to be ensuring the well-being of families and not letting them become homeless. Let's have some accountability to make that happen. These are some of the needs and the things that we can do. In addition to needs, because we should focus on children and families and solve their problem because there are needs there, but I think there's also an opportunity. I think the understanding about the importance of housing to children's health, to their success in school, and to their overall well-being is growing. There's a lot more evidence about the need for that. The political will, including focus on children and families and employment and jobs, that is growing. I'm not sure what the Trump agenda would be on children and families exactly, but Speaker Ryan has talked about this and high-need people, and I don't know, does anybody know what the theme of today's Democratic convention is? Families and children. So I think there's more interest in it, and there's an opportunity there. The political will is growing. We know how to solve child and family homelessness. The scope of the problem makes going to scale possible. I think there's an opportunity in this period of change to make real progress on that issue. So we want the new administration and Congress to commit that by the time they leave Washington, no child or their family will be homeless, and maybe we'll just commit that starting next week, no infant will be unsheltered in the country. And the other goals are equally critical and achievable. That any single adult, woman or man, who becomes homeless will be taken into a supportive and decent shelter that will help them rapidly return to housing on their own, or with others, that the proven solutions to chronic and veteran homelessness are taken to scale, and that we solve these problems, and that homelessness among youth and young adults will be a thing of the past. Getting these commitments alone, the commitments to end homelessness, obviously that is not enough. We will need action and we will need specific strategies. And in the past several months and over those coming, we're going to be working with you and our partners at National Housing and Healthcare and Child and Family, Education and Youth organizations, among many others, to craft action steps. But just to give you a taste of some of the things, the discussions that are going on, we are working with a broad coalition of family, education, healthcare, and housing organizations to advance the proposal for $11 billion in mandatory spending to help homeless families. Short-term, this is the proposal that was in the administration's FY17 budget. We're trying to find champions to migrate that into the new Congress and administration. Short-term action is needed this year, but this is a long-term project. We are going to need your help on the short-term things while you're in Washington, and that's a priority on Hill Day, so people will be talking about that with you coming up. But there's a big coalition, hopefully, forming around that. We are working with our affordable housing colleagues to take advantage of what feels like a moment of opportunity on the affordable housing front to propose a two-scale housing initiative that would stop the ridiculous practice of allowing millions of vulnerable families and individuals to struggle just to put a roof over their heads, especially when not housing them has economic and social costs that outweigh what it would cost to house them. And we are determined and indeed optimistic that we can make progress there. And we are working with the broad coalition of Away Home America to finally scope the breadth and approach to youth and young adult homelessness and to lock in on and fully implement a set of investments to end it. There is so much work to be done, but there is also so much opportunity. What do we need from you all moving forward? Well, first, to vote in November and make sure that every client and tenant is registered, of yours is registered and encouraged to vote. It is going to matter who is in the White House, who is in Congress, who is your governor, your state legislator, your mayor, your city council member. It's going to matter to you, and it's going to matter to the people that you care about. If you are a nonprofit, there is no prohibition against you encouraging and helping people to register to vote or educating them about the voter process. You're allowed to do that. There is no prohibition against you sponsoring candidate forums or asking candidates questions. What you are prohibited from doing is engaging in partisan politics, endorsing a candidate, or ranking candidates on your particular issue. But the voting part, clear sailing. The National Coalition for the Homeless has a table in the lobby, and they have a lot of information about this. They're going to be sharing with us, and we'll be putting out as well, but any of you that want to get more involved or get information should stop by and talk to them. Second is to commit yourselves to innovation. I know that in all of this systems, creating of systems out of programs and coordinated entry and data and all of that, we get very caught up in the bureaucracy, and it's harder to innovate in many ways because of the way things are structured in that work. But we can't abandon that because many of the interventions that are most effective have come, all of them, I guess, really, have come out of local innovation when people saw problems and tried something new to solve them. So we can't stop innovating. Many things we do know how to fix, but there are areas of innovation about how to do things better and where we need other answers. We need to do a lot more on employment. I mean, really people need more income. That's for the majority of people. I think that is going to be the answer. And we're not innovating there. We need to do a lot more around that. We need a more organized approach. These are just a few things that sort of came to mind. I'm sure you have many other ones and more important ones. But approach to helping people share housing. So many of us, the route that most people who aren't homeless really use if they can't afford housing, to make housing affordable, is they share with other people. But we make it really hard for people to share, and we don't have a very systematic way to help them share, which could really cut their housing costs. It seems like we need some innovation around that. We need innovation around encampments, what to do about them, and how to break them down into their constituent pieces. We need housing models for people who don't really want the responsibility of their own apartment, but they want someplace lower demand, simpler to live, where they don't have to pay the rent every month, but maybe can pay it by the day or by the week. We need innovation around housing for episodically homeless people who are using substances and are in and out of the homeless system. And we always need more innovation around effective service delivery and really figuring out what makes a difference. And a third thing I hope you'll think about to actively join us in is in advocacy for change at this critical moment. The problems are huge. I know that racial discrimination and inequity, income inequality, low wages, high housing costs, dysfunctional politics. But there will be change, and we need to be part of the movement through action and advocacy to push change in the right direction. You have made a lot of progress on homelessness. You have shown what you can do. You have shown you know how to make things happen. You're already fighting for justice. You have made that progress against the odds, against the trends that are all pushing in the other direction. This is because of your commitment, because of your skill, because of your innovation, because of your determination. But we are far from done, and you cannot rest on your laurels. We have a lot more to do, and we have to do even better than we've done so far. Homelessness is not the simplest problem in the world, but it's also not that complicated. Housing ends homelessness for people. It also helps people get on with all of the other things that will allow them to achieve well-being and self-fulfillment. The first step is ending their homelessness. The solutions to homelessness are not all that complex, but implementing those solutions can be, I know. Political will, your skill, and resources are what is needed to go all the way. We have a new opportunity to get those things. We know we can solve the problem, so we will ask for what we need so that no child, no family, no young person, no one in our country that is already great is homeless. Thank you.